Hello everyone, I am Sandra May E. Banyola from BSN2 12E of Davao Doctors College. And today I am going to perform open gloving return demonstration. The use of gloves reduces the risk of contaminating the healthcare workers' hands with blood and other bodily fluids, wherein it reduces the risk of germ dissemination to the environment, as well as it reduces the risk of transmission of microorganisms and harmful pathogens from health workers to the patient and vice versa. Prior to the conduct of procedure, I have performed thorough hand washing. We must remember that the use of sterile gloves does not replace hand hygiene, and so must perform hand washing before and after doing this procedure. Okay, so here I have prepared my sterile gloves. Ensure that the gloves are in the right size and check for the packaging if it has stains or tear, for it can be considered as unsterile. It is important to ensure that the gloves fit well for user's comfort and to avoid contamination, because if the gloves are too big, then it can be hard to hold objects and it is much easier for germs to get inside the gloves. And if the gloves are too small, it will most likely to get ripped, or it can cause increased blood flow in the fingers that can result to numbness, pain, and constraints hand movements. So now let's carefully open the package. Notice that there are two covering inside the inner and outer package. Grab the inner package and lay it in a clean, dry surface, because moisture can contaminate the gloves and the area must at waist level for any object below is considered as contaminated. Open the package, keeping the sterile gloves inside. Avoid touching the gloves because that is sterile. Next, identify your dominant hand and non-dominant hand glove for easier application. Each glove has approximately 5 cm cuff, and glove your dominant hand first. And since I'm a right-handed person, I will glove it first. To do this, I need to grasp the cuff of the glove and tuck the thumb in and insert the hand. It is important to remember that with bare hands, we can only touch the inside part of the glove to avoid contaminating it to ensure its sterility. Next, I'm going to glove my non-dominant hand. In order to do this, I am going to slip my 4 fingers beneath the second glove cuff with fingers with thumb abducted. Then carefully pull the second glove over non-dominant hand. Do not allow fingers and thumb of glove dominant hand to touch any part of exposed dominant hand. Keep the thumb of dominant hand abducted back. Then insert your fingers. Then properly arrange the gloves in the hands. interlock fingers of gloves, hands, and hold away from body above waist level area. So again, avoid touching the non-sterile part. So, now we're done donning the sterile gloves. We'll proceed to removing the sterile gloves. As if that our sterile gloves are already soiled, using my dominant cleft hand, grasp the outside cuff of the other glove by pinching it in the palm area and slide your fingers. Then for the non-dominant hand, I am going to slip my fingers under the glove, turning it inside out. Then we can discard now the glove and put it in the receptacle. Don't forget to perform hand hygiene again for before and after the procedure. Then we can put this in the receptacle area. So we have our receptacle area here.